Here's the plain language way to understand early pancreatic warning signs without panic. Your pancreas works quietly all day long, helping you digest fat and protein and helping your blood sugar stay steady between meals. When this organ is irritated or inflamed, the signals can be confusing. Sometimes they look like a stomach bug, sometimes like gallbladder trouble, sometimes like a pulled back muscle. After 60, clear, calm pattern spotting saves you worry and helps you act sooner, which often means easier treatment and faster comfort. This matters for everyday life. Deciding whether to rest at home or call your clinician, knowing which meals are gentler while things settle, and recognizing the red flags that deserve same-day care. In the next few minutes, you'll learn where pancreatic pain usually lives, how it behaves with food and body position, what stool and blood sugar changes can reveal, and exactly when to loop in a professional. You'll also get a simple, gentle eating plan and a 3-step action guide you can start this week. Stay to the end for a 20-second self-check you can repeat at home and the single pattern most people overlook. No scare tactics, just practical physiology, what long experience and large studies suggest, and a clear line for when to seek help. If straightforward guidance like this helps you feel more in control of your health, join our community by subscribing and let me know in the comments what confuses you most: pain location, stool changes, or blood sugar swings. Your questions shape the next videos. Let's begin with the where and how of the discomfort. The pancreas sits deep in the upper abdomen, a little left of center and close to the back. When it's irritated, the sensation is usually steady and centered high in the belly, just beneath the breastbone or slightly to the left, and it often seems to travel straight through to the mid-back. People describe a belt-like pressure that doesn't cramp and release with each bowel movement. It just stays. That steadiness is an important clue. If a meal is heavy or greasy, the pancreas needs to release more enzymes to digest the fat and protein. If the gland is inflamed, that surge can worsen the irritation, so the timing of pain after a rich meal becomes meaningful. Picture a simple day. Lunch includes fried fish and coleslaw. 2 hours later, a steady pressure builds under the breastbone and creeps toward the back. You try an antacid, nothing changes. You aren't rushing to the bathroom with wave-like cramps. You're dealing with a constant, high-centered ache that flares after fatty food. That pattern points more toward the pancreas than a typical food-borne stomach upset, which tends to cramp lower down and improves as the bowels move. If the discomfort is mild, you're not vomiting, and you have no fever or jaundice, it's reasonable to rest, hydrate, and switch to very low-fat, simple foods for a day or two while you keep notes. If the pain is strong and constant for more than 30 to 60 minutes, if you can't keep fluids down, or if you notice yellowing of the eyes, dark urine, clay-colored stools, a racing heartbeat, or a fever, go for urgent care. Acting early is protective, especially after 60. Nausea, vomiting, and sudden loss of appetite tell another part of the story. During a typical short-lived stomach bug, symptoms often arrive quickly after a suspicious meal, include frequent diarrhea, and begin to ease within a day or two as your body clears the culprit. With pancreatic irritation, the signal can be different. Food itself becomes unappealing, especially creamy or greasy foods, and vomiting, if it happens, brings little relief. It's your body's way of saying, "Don't add work my enzymes can't comfortably manage." Even the smell of frying can feel wrong. Think of opening the fridge at dinner and finding that plain toast sits fine, but a spoonful of creamy soup turns your stomach. That aversion to fat is a tip-off. Shift to thin oatmeal cooked with water, clear broths with rice or noodles, soft fruit like bananas or applesauce, and small portions of lean protein. Poached chicken breast, white fish, egg whites, or tofu. Keep portions small and frequent, every 2 to 3 hours, so the pancreas never faces a big load at once. Hydrate with water or diluted electrolyte drinks. Skip alcohol completely. Even small amounts can irritate the gland during a flare. If you can't keep fluids down for 6 hours, you feel dizzy on standing, your mouth is very dry, or your urine turns dark and scant, that's not the time to push through at home. Dehydration arrives quickly after 60 and is more dangerous. Seek care. Stool changes and unplanned weight loss are quiet clues from the digestion side of the pancreas. This organ releases enzymes, lipase for fat, amylase for carbohydrates, proteases for protein. When output is low, fat slips through undigested. Stools may look pale or clay-colored, float, leave an oily film, or be hard to flush. You might notice more gas, a fuller belly after meals, and a slow, unintended slide of the belt notch. Over weeks to months, poor fat absorption can also mean fewer fat-soluble vitamins A, D, E, K get into the body, which matters for energy, bone strength, and easy bruising. If bathroom cleanup becomes harder after pizza and your stools are lighter and float even on plain meals, that's not just age. Keep a short log and tell your clinician. A simple stool test that looks at pancreatic enzyme activity may be part of the workup, and if enzyme support is needed, a prescription product taken with the first bite of food often brings fast relief. Store shelf blends are not a replacement for these. Dose and timing matter, and your care team will tailor both. Blood sugar, noise, can be another early whisper. The pancreas helps digest food, but it also releases insulin, so sugar moves from the bloodstream into your cells. When the gland is inflamed or under strain, insulin release can be erratic. Even if your glucose has been steady for months, you might see higher morning readings, larger spikes after meals, unusual thirst, more frequent urination, or a foggy afternoon slump that doesn't match your usual pattern. Sometimes, a new diabetes diagnosis in someone without typical risk factors is the first sign that the pancreas deserves a closer look. If you already check your glucose, add a few extra readings for a couple of days, one fasting and one 1 to 2 hours after the largest meal. Pair fruit with protein to soften spikes, an apple with egg whites or a small fat-free yogurt, and choose low-fat, high-fiber, steady carb meals while symptoms settle. If numbers run consistently above 250 milligrams per deciliter, if you're nauseated, or if you're urinating every hour with deep thirst, call your clinician the same day. If you use insulin or other diabetes medicines, ask your care team how to adjust safely during illness. A common misconception deserves a quick correction. The presence of diarrhea does not rule out pancreatic trouble. Some people with pancreatic irritation do pass loose stools, especially when fat isn't being digested. The key is whether the bowel movements reduce the pain. In simple food poisoning, the cramps often ease as the bowels move. With pancreatic irritation, the steady, high-centered pain usually doesn't budge. Another misconception: all pancreatic problems are caused by alcohol. While alcohol can inflame the pancreas, especially with heavy or long-term use, many older adults develop pancreatitis from gallstones blocking the shared bile-pancreatic duct, from very high triglycerides, or, more rarely, from medications or structural issues. Never assume the cause on your own. Your story, labs, and imaging together paint the picture. Now, the most overlooked pattern, the one that quietly separates pancreatic pain from garden variety indigestion or a pulled back muscle. 3 details together carry weight. Steady pain in the upper middle of the abdomen that often seems to reach through to the back. A change with body position so that lying flat makes it worse and leaning forward eases it a notch. And a flare within an hour or two after a fatty meal. If those three keep showing up together, especially with fever, a fast pulse, yellowing of the eyes or skin, dark urine, or pale stools, it's time for urgent evaluation instead of watchful waiting. When you arrive in urgent care or the emergency department, the team will look at your vital signs, check specific blood tests. Lipase is the most informative enzyme in this setting. Review your medications and often order an ultrasound to look for gallstones. Treatment focuses on fluids, pain control, and identifying the cause. Early help reduces complications and usually means a smoother recovery. It's worth adding a few words about gallstones because they're so common after 60 and so closely tied to the pancreas. Small stones can slip into the shared duct and block the flow of bile and pancreatic juice. The combination of upper right or central pain, yellowing of the eyes, dark urine, clay-colored stools, fever, and sometimes chills should prompt care now, not tomorrow. That cluster suggests blockage, and quick attention protects you. Mid-video check-in. If this kind of step-by-step explanation is making things clearer, tap subscribe so you don't miss the follow-up on gentle, pancreas-friendly grocery planning. While you're monitoring symptoms or recovering from a confirmed flare, choosing meals that are easy on the pancreas makes a noticeable difference. Think texture first, soft, simple, and low-fat for 48 to 72 hours, then a gradual return to normal as you feel better. Oatmeal cooked with water, clear soups with rice or noodles, mashed potatoes made with broth, well-cooked vegetables like carrots and green beans, and soft fruits such as bananas or canned peaches in their own juice are friendly choices. Keep added fats very low. If you need flavor, try herbs, a squeeze of lemon, or a splash of vinegar rather than butter or cream. Protein is still important, but small portions spaced through the day go down easier than one large serving. A few ounces of poached chicken or turkey breast, white fish like cod or tilapia, egg whites, or tofu fit well. If you tolerate dairy, a small serving of fat-free Greek yogurt can work. If not, skip it and choose another lean option. Hydrate with water or diluted electrolyte drinks. Limit fizzy beverages if they cause bloating. Sip consistently, don't chug. Cooking method matters more than the recipe title. Baking, steaming, poaching, pressure cooking, or air frying with a light spray keeps fat lower. Skillet meals that require several tablespoons of oil are harder on the pancreas, especially in the first days after symptoms. If you use oil, measure with a teaspoon rather than pouring from the bottle. Watch the usual suspects: sausage, bacon, salami, fatty beef cuts, cream sauces, buttery pastries, full-fat cheeses, fried foods, and big spoonfuls of nut butter can all push symptoms. Nuts themselves can be reintroduced later in small portions when you're feeling better. Chew well, and pay attention to how you feel afterward. When you're recovering, build days around 3 small meals and 2 small snacks. Chew thoroughly, and stop before you feel full. The goal is to avoid large enzyme demands while keeping calories coming in. If you're losing weight unintentionally or you find the list overwhelming, ask for a referral to a dietitian who works with pancreatic conditions. A few personalized tweaks often restore comfort and confidence. Here's a simple path you can start this week. Begin with 48 hours of gentle meals and steady hydration if you're in the maybe zone, upper-centered steady discomfort, mild nausea, no fever, and no red flags. Keep a small notebook with what you ate, when symptoms appeared, and whether pain changed with body position. If discomfort persists or reliably returns after meals, arrange a same-day call with your clinician and share your log. Ask whether a lipase test and an ultrasound are appropriate. If stools have been pale, floating, or greasy, ask about a stool test that evaluates enzyme output. If your fasting triglycerides have been high in the past, ask to recheck them. Very high levels increase pancreatitis risk and deserve a plan. At the same time, stabilize the things you can control. Keep daily fat intake low while symptoms settle. Spread protein across the day. Pair carbohydrates with lean protein to avoid big sugar spikes. If you live with diabetes or prediabetes, add a couple of extra glucose checks for a few days, one fasting and one after your largest meal, and share the numbers with your clinician. Bring a complete medication list to your visit so your care team can spot rare contributors and plan safely. A gentle reminder about over-the-counter enzyme blends and digestive pills. During a watch and call period, focus on food and fluids rather than adding unproven supplements. If your clinician diagnoses enzyme insufficiency, prescription pancreatic enzymes taken with the first bite of food are the tool that helps digest fat and protein properly. Dose, timing, and product choice matter. Your team will guide you. Let's turn the advice into meals you can actually make. For breakfast, think thin oatmeal cooked with water, topped with a few soft berries and a sprinkle of cinnamon. If you want protein, add egg whites on the side. Skip butter and cream. For lunch, try poached chicken breast sliced over soft rice with steamed carrots and peas. Brighten the plate with lemon and herbs, not creamy dressing. For a snack, choose applesauce, a small banana, or a modest serving of fat-free Greek yogurt if it sits well. For dinner, bake white fish with a squeeze of lemon. Serve it with mashed potatoes made with broth and add well-cooked green beans. If you want something sweet, a small cup of canned peaches in their own juice is usually gentle. Portions can be simple. Protein about the size of your palm, gentle carbohydrates about the size of your fist, and vegetables filling the rest of the plate. During the first days, think teaspoons of added fat, not tablespoons. As you feel better, reintroduce variety slowly. Add a teaspoon of olive oil to vegetables. Try a small portion of a familiar food and listen for your body's feedback. If pain or nausea returns, step back to simpler meals and call your clinician. Here's the 20-second self-check you can repeat at home. While seated, place a hand flat over the upper middle of your abdomen just below the breastbone. Take a slow nasal breath in, then breathe out through pursed lips and lean slightly forward, as if resting your elbows on your knees. Notice whether that position eases a steady ache you felt when lying back. The next day, after your largest meal, check whether that same area becomes more uncomfortable within 30 to 90 minutes, especially if the meal included fat. When easing forward helps and fatty meals predictably bring on the steady, high-centered pain that seems to reach to the back, it's time for a same-day call, even if the pain isn't extreme. Patterns matter more than one loud moment. Red flags deserve one clear paragraph so you can act without hesitation. Severe constant pain for more than an hour. Pain that reaches through to the back and worsens lying flat. Repeated vomiting that prevents fluids from staying down. Fever or chills. Yellowing of the eyes or skin. Dark urine. Pale or gray stools. Confusion, faintness, or a heart rate that stays high. If you see that cluster, go for urgent care or the emergency department now. Getting fluids and pain control early is not overreacting. It's wise. To keep the week simple, speak your plan out loud. Low fat, small meals, steady hydration, gentle proteins in small portions, rest, no alcohol, logs for pain, meals, and body position. Early clinician contact if patterns repeat or red flags appear. Small, steady steps protect your energy and peace of mind far better than pushing through. It's natural to worry when you learn about pancreatic problems. Here's the reassuring part. Catching patterns early and treating the cause. Removing a gallstone blockage. Resting the gland with gentle meals and fluids. Adjusting medicines, or using prescription enzymes when needed, often restores comfort and prevents complications. Your job is not to diagnose yourself. It's to notice the right details and partner with your care team. I'll link plain language resources and practical guides in the description so you can read more if you enjoy details or want a printer-friendly plan. Before we close, share in the comments what you'll try first. Earlier low-fat dinners, a small protein with carb pairing to steady sugars, or simply writing down the pain position timing pattern for a few days. Your notes help neighbors over 60 feel safer as they learn their own signals. If this was useful, subscribe and pass it to a friend who appreciates clear, calm health guidance. Next time, we'll build a short, pancreas-friendly grocery list and a one-week menu that's easy to cook for 1 or 2 people. Take gentle care of yourself today, and I'll see you in the next video.